Greetings, everyone. My name is Cinzia Donato. I'm the R&D manager at Scailyte, focusing my efforts in women's health area. I'm a scientist by training with a strong background in breast cancer research and liquid biopsy. But today, I'm happy to kick off Scailyte's virtual interview series on endometriosis. Scailyte is a precision medicine company based in Switzerland. We discover clinically relevant biomarkers starting from single-cell datasets and clinical datasets. We have developed our proprietary machine learning algorithm platform called SkyVision to discover unique cell populations and biomarkers for their use in diagnostics, prognostics, and treatment. SkyVision has been used in a variety of biomarker discovery projects in collaboration with clinical, academic, and business partners. We have tackled projects in immunology and oncology space, as well as in women's health. Together with the University of Bern and Inselspital Bern, Scailyte is on a mission to advance endometriosis research and knowledge, and we aim to do so in Switzerland and around the globe. Globally, 1 in 10 women of the reproductive age is affected by endometriosis. Yet many people are unaware of what this disease is and the pain, disruption of daily life, countless of medical visits and burdensome treatments that it entails. Endometriosis is a chronic disease characterized by the growth of endometrial tissue, the inner layer of the uterus, outside of the uterus itself, causing inflammation, often infertility, and as just mentioned, pain. Women as young as 12 years old can suffer from it. Diagnosis, treatment, and management of the disease are fields with a lot of room of improvement. This seminar and the seminar series marks the beginning of Scailyte's endometriosis awareness. In this series, we are interviewing prominent exponents and stakeholders to discuss awareness, challenges, and opportunities in endometriosis. Just a little disclaimer, when we speak about girls and women, we also refer to transgender and non-binary individuals. Today, we're speaking with Dr. Sara Imboden from the Frauenklinik of the Inselspital in Bern, Switzerland. She's a senior consultant at the Gynecological Clinic at Inselspital and the responsible physician for the certified specialized endometriosis center at Inselspital. Sara obtained her medical degree in Bern, Switzerland. She did her residency in Thun and Bern in surgery and gynecology. Later, she obtained a fellowship in Bern, and in 2017, Sara obtained also a research fellowship from the Karolinska Institute in Stockholm, Sweden. She's an active endometriosis researcher covering clinical topics ranging from the symptomatology, biomarkers, comorbidities, to surgical interventions in the context of various gynecological diseases. We are very honored to have her with us today. Hello, Sara. How are you?
Hello, Cinzia. Thank you for having me here.
Our pleasure. We would like to start with a very simple question about endometriosis. Currently, from the onset of endometriosis symptoms, it typically takes 7 to 10 years for a woman to receive a definite diagnosis. Why is this still the case?
That's a very good question, because I really feel we should be able to reduce this time significantly due to better diagnostic in the clinical sense, that people are more aware of the diagnosis endometriosis and more willing to give the diagnosis. Earlier on, you always said you need a laparoscopy to give the diagnosis, and we're getting away from that since a couple of years. So that's one point where I think we will get a lot better. On the other hand, like you, many people are working on diagnostic tests. So hopefully we will have that soon, that we can give a clear answer. Yes, it is endometriosis and not. And I do think we need a lot of work of awareness of the disease endometriosis in all people, and also in the doctors and the practitioners dealing with patients with these symptoms.
Right. Thank you. So how important is the laparoscopic investigation to diagnose patients? In which cases it is vital?
Nowadays, it is really not used as diagnostic. We do a laparoscopy when the goal is to do a treatment of the endometriosis. And with that, of course, we confirm the diagnosis. In very few cases, if conservatively we don't advance, we keep on turning around at the same point, the medications don't work, it can result in a diagnostic laparoscopy, at the same time removing of endometriosis if there is endometriosis, but also really to confirm the diagnosis, even if there's only a couple of small lesions. But that is rarely the case. The goal of laparoscopy today should be for treatment, not for diagnostic.
And a lot of patients start treatment even before they have a what's called a gold standard diagnosis. How important is it to then have a definite diagnosis before you start this treatment? Is it even necessary?
It helps the patient understand why she might take hormones, for example. Many young people don't want to take hormones nowadays. So it kind of helps them if they would know, yes, I really do have endometriosis, and that's why I do this treatment. On the other hand, what we are mostly treating is the symptoms. So I am quite fast to say, I'm not 100% sure if you do have endometriosis, but you have the pain, you have severe pain during your period, so we probably should stop your period. And then at that point, it doesn't really matter if she really has endometriosis or not, because we have to treat the symptoms. On the other hand, we do believe that if by diagnosing endometriosis earlier, possibly we can really have a better follow-up of the patient and avoid that later on in her life she might have infertility due to endometriosis.
Yeah, so having a early diagnosis is beneficial for then directing patients into the right treatments.
Yes.
Are doctors, general practitioners, and OBGYNs, so like German Hausarzt and Frauenarzt, what's their role in the diagnostic delay? We know that there is this huge delay. So, is it lack of awareness among these practitioners that is causing part of the delay?
That's a very difficult question, because I'm sure every gynecologist knows what endometriosis is, and every general practitioner has heard about it. So I think there, in training and in education, everybody knows endometriosis. I think through many years of only giving the diagnosis when we have a laparoscopy made the people shy to really say, we don't see very much in ultrasound, but still, due to the symptoms, I think you really have endometriosis. So often the patients might have heard, well, I don't see anything. I just had a patient yesterday. She said, 10 years ago, my gynecologist said, we were talking about endometriosis, and she said, well, I don't see anything on ultrasound. And she probably didn't even mean that means I don't see anything, but that does not mean you don't have endometriosis. But the patient understood it that way. So for 10 years, she had no treatment, and she has a severe endometriosis now. And I think due to the fact that possibly we will have good diagnostic tests, and we are getting better clinically, and we are getting more aware that if we have the symptoms and any sign clinically, we call it endometriosis, that we will get better. And if people who maybe see less endometriosis also get more aware of the disease and of the diagnostic criteria and are more bold in saying, yes, I do think this is endometriosis, that will help a lot.
Moving away from the clinical side, what are the type of research and development initiatives that are needed to shorten the path to diagnosis?
We need a lot of research still to be done in endometriosis, and I think on different levels. We need to understand why one woman develops endometriosis and the other doesn't. So that's really the basic research in understanding why someone has endometriosis, where we really need a lot of work, and that also needs a lot of money and a lot of people who are interested in the disease. The second point, which you are asking for more as a diagnostic, is yes, of course, having a diagnostic test will help us give the answer to the patient. Yes, you have endometriosis, or no, you don't. That doesn't solve all the problems, but that's kind of a good step to giving the disease a clear name and then going for a clear treatment plan, since we know the patient has the disease. I also think we need then also more clinical research, which kind of tells us which treatment helps most. We desperately need also medical treatment, which is a non-hormonal basis, treatment for the women who are trying to get pregnant and have symptoms, because for those the hormonal treatments is all not possible. So I think there are different levels where we need a lot of research to be done. So we need a lot of people who are interested in endometriosis. We need a lot of financing by also grant institutes and private firms which are willing to go for this disease, which is, okay, it's a benign disease. I think that's what makes research funding always more difficult. But I think that's why we are working on all these awareness programs to show that it's a disease which nevertheless has a high impact on the women.
Absolutely, definitely on their lifestyle. Moving along into the treatment of endometriosis, what are the main challenges that you face as a practitioner when treating endometriosis patients? How does the heterogeneity of the disease play a role in it?
I think nowadays we talk a lot more about a chronic disease. So we have to diagnose endometriosis, and then we have to treat these women sometimes for 20, 30 years. So depending on their life phase, the treatment is different. And we have to adapt the treatment to their life phase and to their needs. So that is a challenge for me, that we always try to find the right treatment at the right point of the life, which can change every couple of years, for example. And it's often you have to kind of figure out what is the right treatment. That makes it challenging. In surgery, what I find challenging is that we do very radical surgery for a benign disease. So we have young women who have a benign disease, and we do very radical surgery. And that's always also a very difficult balance to find and hold, so we don't produce any morbidity.
What are you and experts like yourself doing to spread awareness and to advance and promote research?
We have many projects because we believe it's very important to kind of spread the awareness for endometriosis. We have a project where we start early on in age. It's called EndoTeach. I have a medical student who's doing a medical degree on this topic, and she's going to schools, and we have a set of information for the teachers and for the kids. It's for like 12 to 14-year-olds, where we want to talk about what is a normal menstruation and when is it not normal, because we really want to avoid that we have these girls who can't go to gym because they have terrible pain during their menstruation, and they're always looked at as, oh, they're just weak, and everyone has their period, they're being complicated, they just don't want to go to gym. So there's this project where we really try to work on that. If a young woman really has pain during her menstruation, that possibly that's a disease. Doesn't have to be, but possibly it's a disease, and not that they just are lazy or don't want to go to school. So that's our first project. Then also, like in the Awareness Month now, we have information presentations for students, for patients or people interested in endometriosis. We have workshops where we kind of go through topics, kind of general topics and there it's really the idea, it's not only for patients, it's also for people around them. Like very interesting, like in this, the movie we had yesterday, there were a lot of men who came along. Often there's mothers who come along because they kind of want to understand why their partner, their daughter, their wife are suffering that much. And I think that's also very important. Also, of course, we have many research projects about clinical research where we want to kind of understand the effect of surgery, effect of treatments on patients with endometriosis.
If you and your group is looking for advocates and for support, how can people reach out?
We are always interested in people who are engaged and interested in endometriosis. If we're talking about research, collaborations like with you are very, very important, because at the end of the day, we are all clinicians working 100% in clinic. So we need people who can really focus on research. So anybody interested in research and who wants kind of the clinical opinion, our contact is always very welcome. We also, for example, work well together with the Endo Help group. That's a group of patients who organize themselves, and that's always very important. So like that, we have the patient's view and not what we think the patients think. It's very important that we have this aspect too. And of course, any form of financial support for research is always welcome.
Thank you very much, Sara. Thank you for your time and for sharing your precious perspective with us. And thank you to all of you for your attention and interest in learning more about endometriosis. This is a sensitive and yet extremely important topic to discuss. Through collaboration, as we heard today, we can promote awareness and take action to move governments, big companies, small companies, foundations, private and public sectors. All of this to support research and clinical advancements. Scailyte is in the forefront of this effort. Stay tuned for the next episodes of this series.